really take this into consideration, or even the clinical directors or the administrators should take it into consideration, because just because you have 20 patients on a floor and you have adequate amount of nurses, it doesn't mean that you're going to have a good day. Also, you have to look at the diagnosis of the patients as well. You can have surgical patients, heart failure patients. It ranges from mild to really severe patients, and they should take that into consideration. Also, clinical directors should take into consideration the amount of years of nursing that you have had. Most of the time, people require, or seasoned nurses have more knowledge than novice nurses, of course, because they've been in the nursing field for a long period of time. Novice nurses are just coming into the nursing field, so they really don't have that knowledge base as the seasoned nurses do. So with that being said, if you come from a school where you've only gotten an associate's degree, most institutions now want you to get a bachelor's degree so you can have advanced knowledge on how to take care of your patients and make good clinical decisions, so you'll be ready to clinically think and think on your feet and think outside the box as well. Also, the budget cuts has forced us to have to work together, use our resources, and not be able to care really about, in so many words, don't care about our patients, because we are not able to fully take care of our patients because we don't have the staff, or we don't have time to really sit and talk to the patient, see what they need, because we're being pulled from patient to patient, and we don't have time to really do that, the thorough assessment that we would like to have. So with that being said, a lot of the data that was used in this article, the data was 2,531 patients were admitted to 7 medical units and 10 surgical units on a 2,300 unit bed of a hospital in Thailand. The information was extracted from the patient charts and discharge summaries in the calendar year of 1999. The multivariate logistic regression model was used to determine the relationship between the nursing staff and the mortality rates. The sample population consisted of patients that had pneumonia, cancers, hypertension, and heart problems. A univariate logistic regression model was done to examine each individual independent variable along with matching it to the mortality rates, and the p-value was set at 0.05. In conclusion, there is a link with decreased nursing staff and an increase in mortality rates. Our professional leaders, administrators, and directors should see a trend and try to intervene immediately to decrease the mortality rates. The strengths and weaknesses were: the findings are limited to only one hospital in Thailand, which would make this a weakness. In order to make it a strength, I think that they should have expounded their research to more hospitals in Thailand. And a strength would be, we found a positive link between mortality with nursing shortages. Nursing shortages is still continuing to be, it's turning into an epidemic really. So what we really need is, we need more nurses to go back to school and continue their education. And also, we need to encourage the nurses that have the lower level to increase their knowledge base and to go back to school to get those educations and those degrees so we can make the world a better place. Thank you.